Fungal infections can be stubborn, but in my practice I've found compounded salicylic acid 5% solution to be extremely effective. In this video, I'll explain the role of salicylic acid in treatment of fungal infection and how to compound it safely. Fungal infections such as dermatophytosis or ringworm are common skin conditions caused by a group of fungus called dermatophytes. They often affect the skin, nails, or scalp. It begin as circular or oval, scaly patches or plaques. Over time, the lesions expand outward and develop central clearing, resulting in the characteristic annular, or ring-shaped, and plaque giving rise to the name ringworm. Itching, or pruritus, is common. As pharmacists, recognizing these infections is crucial because the right topical treatment can prevent progression and reduce recurrence. In my practice I've seen many cases respond effectively to compounded 5% salicylic acid. How to compound salicylic acid 5% solution in ethanol 70%. Salicylic acid is a colorless or white crystalline powder. A 5% salicylic acid solution in 70% ethanol can be compounded to prepare 100 ml of a topical keratolytic and antifungal adjunct formulation. Compounding procedure: weigh accurately 5 grams of salicylic acid. Dissolve the measured salicylic acid in 73.7 ml of 95% ethanol with gentle stirring until a clear solution is obtained. Dilute the solution with purified water to a final ethanol concentration of approximately 70% by adjusting the total volume to 100 ml. Mix the solution thoroughly to ensure uniformity. Transfer the finished solution into an amber glass bottle. Label appropriately with for external use only. Store it at room temperature in a tight and light-resistant container. What is mechanism action of compounded salicylic acid 5%? A compounded 5% salicylic acid solution in 70% ethanol provides following key therapeutic benefits. This solution softens a thickened and infected skin, thereby reducing scaling and improving skin texture, enhancing an antifungal penetration, allowing topical antifungal agents to reach the deeper layers of the infected area more effectively, and removing fungal buildup on the skin, thereby reducing the overall fungal load. In addition, salicylic acid 5% is compounded using ethyl alcohol as a solvent. Upon application to the skin, the alcohol base evaporates, resulting in a drying effect that creates an environment less favorable to fungal growth. These therapeutic effects make the compounded salicylic acid 5% a valuable adjunct in cases where standard therapy alone may be insufficient. Clinical results of salicylic acid 5%. Here, you can see the before and after images showing the noticeable improvement after using the compounded 5% salicylic acid solution. In the before image, the affected area shows clear signs of inflammation, redness, circular scaling, and irritation typical of fungal infection. After consistent application of the salicylic acid solution, the after image reveals a remarkable improvement, with most of the infected area visibly cleared and the skin appearing smoother and healthier. Side effects and precautions of compounded salicylic acid 5%. While compounded 5% salicylic acid in an alcohol base is generally well tolerated, certain side effects may be observed. Mild dryness, redness, or irritation may occur due to the alcohol content, which can be managed by applying a gentle moisturizer after the solution has dried. Precautions. Discontinue treatment and consult a healthcare professional if an allergic reaction occurs. Avoid applying the solution to broken skin. Keep the treated area away from eyes, mucous membranes, and sensitive regions. By following these precautions and tips, you can maximize the effectiveness of your treatment while minimizing any risks. As pharmacists, our role goes beyond dispensing medications. Understanding alternative treatments and compounding options, like 5% salicylic acid for stubborn fungal infections, can make a real difference in patient outcomes. Thank you for watching. If you found this useful, consider subscribing to my channel for more clinical updates and practical tips.